Hello everyone, my name is Xinyu Yin. Today's video is about whether Amy should choose Orlistat to lose weight. The structure of the whole video is a history, diet pills, introduction for Orlistat, mechanism of action, side effects, case analysis, and summary. Since the late 19th century, the attitude towards weight, especially for women, has shifted to a more slim and sporty appearance. This change has led to a search for solutions that make losing weight easier. Because of this, many people like Amy who pursue fast weight loss take diet pills. First, we can briefly understand the history of diet pills. The first weight loss drug came out in the patent drug era in the late 18th century. They're based on thyroid extract and can increase the metabolic rate. Basic side effects include abnormal heartbeat, fast heart rate, weakness, chest pain, hypertension, and even death. In the 1930s, a weight loss therapy using a new drug called dinitrophenol appeared. The drug has been proven to have a thermogenic effect on the body with a risk of accidental death from hypothermia and severe skin rashes, impaired taste, and eye cataracts. In the middle of the 20th century, weight loss therapy using amphetamine, aminoxyphenolate, and thyroid hormone emerged. However, it has been proved that the risk of abuse and the adverse neurological and psychological effects are more important than the value provided by drugs. In the 21st century, the latest to enter the field of weight loss medications is Orlistat, which is also the focus of this video. Orlistat is one of the few FDA-approved obesity drugs and has been evaluated in long-term clinical trials of obesity and several obesity-related complications. Orlistat belongs to a class of drugs called lipase inhibitors. Lipase is an enzyme produced in the gastrointestinal tract to decompose dietary fat. Orlistat causes fat malabsorption by inhibiting the role of significant GI lipases, thereby reducing the absorption of dietary fat by about 30%. With this change, increased fecal fat excretion and predictable consequences may include diarrhea, abdominal distension, stool urgency, and fecal incontinence. It has been demonstrated to be associated with moderate weight loss in various clinical trial environments. It can last up to 48 months combined with a proper calorie-deficient diet and an increased physical activity program. However, most obese patients recovered most of their initial weight loss during the successful intervention. Also, although the weight loss caused by Orlistat is still moderate, it helps reduce hazardous abdominal fat, called visceral fat, related to type 2 diabetes, hypertension, heart disease, and stroke. In addition, the lipase inhibitor has no severe side effects or appetite suppressants. Enzymes in the stomach typically break down fat, which is then absorbed into the body to be stored. By preventing enzymes from performing to their maximum potential, Orlistat reduces the amount of fat absorbed by 50%. By binding to the active core of the enzyme and lowering its activity, Orlistat inhibits lipase. As a result, the fat cannot be absorbed and instead passes through the digestive system without being excreted. Obese and healthy subjects absorbed little Orlistat. Doses up to 800 mg do not produce plasma concentration over 5 nanogram per milliliter. The animal study for Orlistat showed that the bioavailability was less than or equal to 1.9%, and there was no evidence to support the complete tissue accumulation for Orlistat. At the same time, the metabolism of Orlistat is very little and almost only occurs in the small intestine wall. The paralactone rings hydrolysate M1 and M3 are Orlistat's main metabolites. Due to the fragmentation of the mechanically essential lactone ring and their low plasma concentration, these metabolites, which make up 42% of total plasma biological activity, are regarded as pharmacologically inactive. Orlistat's principal route of elimination is through feces, as predicted by its pharmacology, with renal elimination accounting for the remainder. The two methods of elimination take a combined 3 to 5 days to complete, while the half-life of medication is 1 to 2 hours. Gastrointestinal side effects are the most common adverse events of Orlistat. Oily spots are the most common, and exhaust, urgent defecation, and fat oily stool are also standard. Oily excretion increases elimination, and fecal incontinence is also common. The frequency of these side effects is so high that some call them therapeutic effects. Public Citizen, a non-profit organization, said that Ali had been proven to cause precancerous lesions in the colon of mice. What we know is that these lesions occur much more frequently in people who do have colon cancer, said Dr. Xinyu Wolf, director of the Public Citizen Health Research Institute. Malabsorption. Although Orlistat is considered safe, its increased fat excretion may lead to potential defects in the absorption of fat-soluble nutrients. Due to the inherent fat absorption resistance of the drug, it is recommended to supplement fat-soluble vitamins while using Orlistat. Several studies conducted among obese adolescents showed that although vitamins E and D were increased, vitamin E and D absorption decreased significantly in statistics, but had no significant effects on vitamins A and K. Because of Orlistat's low systemic absorption, the drug-drug interaction risk is relatively low. However, due to the potential change in vitamin K status and the possibility of resulting blood coagulation change drug interactions, there is an indirect interaction between Orlistat and warfarin, and it is essential to monitor prothrombin time when using them simultaneously. In addition, because amiodarone is lipophilic, it will reduce absorption when taken with Orlistat. There have been several reports of decreased cyclosporin absorption, which may lead to organ rejection. Case 1. Orlistat's effectiveness as a dietary supplement for lowering body fat levels in adults and adolescents has been widely studied. In a multi-center, randomized, double-blind, placebo-controlled trial involving 89 obese people, Orlistat demonstrated an absolute fat loss of roughly 3.69 kg, but only after 24 weeks of treatment as compared to placebo. The Xinyu study, the Orlistat trial with the longest length, examined the drug's effectiveness in avoiding diabetes in obese patients. In this 4-year double-blind, placebo-controlled prospective study conducted in Sweden, 3,305 adult patients with a body mass index of less than 30 kilograms per meter were randomized to receive either Orlistat 120 mg or a placebo with meals 3 times per day, depending on their level of normal or impaired glucose tolerance. Patients with Xinyu who took Orlistat experienced a 6.2% diabetes incidence rate, while those who took a placebo experienced a 9% incidence rate. Additionally, patients assigned to the Orlistat group saw significant improvements in their diastolic blood pressure, systolic blood pressure, total cholesterol, low-density lipoprotein cholesterol, waist circumference, blood sugar, and insulin levels in the first and 4th years when compared to placebo. However, in this trial, 91% of Orlistat-treated patients experienced at least one gastrointestinal issue, and 8% of them withdrew from the study as a result of negative side effects. Additionally, there's still a chance of developing colorectal cancer because of the extra fat in the colon. In contrast, a large cohort study showed no risk of colorectal cancer after taking Orlistat. Conclusion. Although Orlistat is probably the most commonly prescribed and FDA-approved anti-obesity agent, and its efficacy as a weight loss adjuvant is moderate, the typical expected weight loss is usually 5 to 10% of the baseline range, but it will bring about local abdominal cramps, oil stains, and abdominal diarrhea side effects. At the same time, those who need to take care should adjust their eating habits and take multivitamins orally. From my point of view, Amy is not recommended to use this diet pill because she is very young and has a high basal metabolism. The goal of losing weight can be achieved through a healthy way of losing weight. The side effects of taking diet pills vary from person to person. Amy's safety cannot fully guarantee security without a doctor's care.